Ontario's long-term care homes were not equipped or ready for COVID. That was just one of the conclusions of a report released today by Ontario's Auditor General. Bonnie Lysyk today said there are no surprises in her report, and there aren't, but it certainly found fault with how the government handled the pandemic.
There was no iron ring.
I will take no lessons from you.
The government was facing heat in the legislature again after the AG report was released. It listed issues in long-term care that are by now sadly well known. Systemic problems which go back decades, understaffing and lack of training contributed to COVID spread, which killed close to 4,000 long-term care residents, as well as 11 staff. The Minister of Long-Term Care repeatedly put the blame on previous governments.
It's kind of like running into a burning building. You know, you're trying to save it, and you're doing your very best, but the fire had started.
They may have not started the fire, but they poured gasoline on it.
The report lays blame on the Ford government, citing a lack of proactive inspections and a lack of clear direction from Ontario's Chief Medical Officer of Health, Dr. David Williams. Long-term care homes were ill-prepared in infection control, and yet the report finds they were left to stop the spread on their own.
I would say that some decisions were taken that complicated the long-term care homes' ability to deal with their residents during the pandemic.
The report comes just 2 days before the Long-Term Care Commission releases its report on what went so wrong in long-term care homes during the pandemic. One other important development to tell you about, the Minister of Health, Christine Elliott, announced a temporary emergency order today, allowing patients who no longer need acute hospital care to be transferred, if necessary, to a long-term care or retirement home without their consent. That's to ease the burden on hospital capacity. This reflects concerns ICUs are overwhelmed. Currently, there are 877 patients in intensive care.